Welcome back to the Osteoclast examination series. Today we're talking about the myths and some tips and tricks for the Orthopaedic Fellowship Exam in Australia and New Zealand with Ric Angliss, who is a former chair and chief of the examination court for orthopaedics. Maybe we'll start with some tips. Do you have any general advice for the examination? I know we've talked about it a lot in the previous episodes of this series, but what are your overall, pearls of wisdom? What do you tell people when they're walking into the doors on the day? I know that there's a little welcome pep talk.
Yep.
I remember.
So that was actually something that the senior examiner before me, Paul Pincus, really sort of brought in, which I really like because it's a very human touch, that because the senior examiner is not assessing you and they have no influence over your marks, all they're doing is collating on the day, they can come in and have a chat and try and lighten the mood a little bit, and it also gives us an opportunity to look around the group and see if there's people who are really sort of in trouble, if they're really so stressed that they're going to have issues from that point of view, and so we do a bit of pastoral care in that respect as well. So we come and have a chat with you and before every segment, and I think that's a really nice touch. Usually by the last segment, there are lots of smiles and people have actually reported that they've actually enjoyed the exam.
That's unusual, isn't it?
Yeah.
And what sort of advice do you give people in that little, few minutes before they walk into their first session?
Look, when you walk into that first session, the only things that you can control in that moment are keeping your head, the basic principles. Answer the question that's put in front of you. If you're not sure about something, get it clarified. To be yourself. The worst thing that happens is you walk into the exam and you try and put on a persona that's not you, because that just makes it 10 times harder. Just be yourself and speak the way that you normally speak. If you feel that you've said something that's subsequently you don't agree with, you can't take it back, but you can, on mature reflection, change your mind. Mm-hmm. That's a good part of higher decision making. Being flexible, being able to, take in new information and move forward. So try and keep as calm as possible. A little bit of stress helps performance, but overwhelming stress doesn't. If you feel you need to stop, have a glass of water, just collect your thoughts, that's fine. One good way of doing that is to say, can I just have a look back at the stem? So it's almost a bit like a think time.
Pause for break.
But the examiners will be mentoring you as well. They'll be sort of looking, and if you're really overwhelmed, they'll say, no, just hang on a touch. This is what you've said already. You've done this, you've done that, you've done another. I worked with a guy when I was very junior. He'd been on the court for a long time. One of his techniques was it was like Who Wants to Be a Millionaire. He would say, when you got to a certain point, he'd lean forward in his chair and said, now we agree with you. And all of a sudden you thought, oh, okay, at least they've agreed with me. Thank God for that. And then you can move the case forward. So the examiners are very good at helping you along. Mm-hmm. So trust them.
That's reassuring.
And we're going to talk about myths and legends and all that sort of stuff in a minute. But one of the big myths that people think is that there are tricks, that the examiners have got little landmines around the exam. That they've used a negative instead of a positive, and that's meant to trip you up, or they'll allow you to have enough rope to hang yourself, or they're just taking you down the wrong pathway to see if you remember. That just doesn't happen.
They're not out to get you.
We don't put up X-rays that are labelled right but are actually left. We don't do that.
Not on purpose.
Not on purpose. If we've done that, we've made a mistake as examiners. But the exam is way beyond any of that sort of rubbish.
On the flip side, if you are there to help us, what are the cues that we might want to take that we're perhaps being redirected to a more suitable path? What sort of tactics will we maybe encounter that we should say, this person's throwing me a lifeline?
Every examiner is a bit different. You're not going to get too many people who say, are you sure about that? Because again, you think, I have to be decisive. Surely I have to be sure if I'm going to be a surgeon. But am I sure? I'm not sure. So you actually want to listen to the tone of voice of the examiner. What I would used to do was say, well, you said that and that and that. So what you've just said, does that fit with that or not? And get someone to rethink about what they've actually just said. You know, if it's a completely glaring anomaly, or you know, if you've said valgus and you mean varus, the examiner's got two choices. They either accept that you've completely don't understand the difference between varus and valgus, and then write that down as a negative. But most examiners won't do that, and I don't think any examiner would do that. They understand that they're going to be slips of the tongue. They're going to say, valgus? Oh, did I say valgus? No, I meant varus. Varus. This is a varus knee. Okay, now we all agree this is a varus
knee. So maybe
knee.
a pause for reflection might be an indication that just rethink what you've said. Or
A redirection. It's not a prompt. It's not a dragging you along. It's a redirection to just think about another direction that you might go with the case. And things like CIM. In the CIM section we talked about that. If you're always thinking that it's a tumour, but in fact the case is an infection, they'll try and redirect you down that pathway.
Okay.
By putting up a slide that shows you an ESR of 273 or something of that nature.
And you think, dope, infection. In terms of some last minute myths, I guess, about the exam, certainly in the preparation for my exam, I had a lot of people telling me that I need to know these really specific things about lots of different topics. So lots of breadth and also lots of depth. Would you say that's what you're looking for in your candidates in the exam?
No, to the point where you've got the breadth and depth of a surgeon starting out in their career, then yes. I mean, we're talking about a very high level exam, but it's not an exam in subspecialty. You're not being examined on the latest and controversial things in shoulder surgery or spinal surgery, or it's general principles. It's how to stay out of trouble. It's how to understand disease process. It's how to be there and responsible and safe for the patients that you're going to see as you're building your experience. So no, you're not meant to come. You're not meant to be examined in the exam as a 25-year-old veteran of foot and ankle surgery.
Yep.
And you won't be examined to that level.
So I often found that I was in some of the study sessions, or particularly when a subspecialty consultant perhaps is teaching you in something they've got a biased interest in, the level of depth expected was quite different to what I think was asked of me in the exam. And there were certainly areas that I couldn't go to the depth that I think other people told me I had to before I went in, and I sort of felt like I wasn't ready. But
so I guess that's one of the issues when you're sourcing people to help with your tutoring and training. You just need to keep an eye on that a little bit, because that person will be very focused on their own area. But you don't have to be a subspecialty surgeon in that area to pass the exam. And it's really up to the candidate to filter that and get that level, of what they need to have and what they don't. But going into the exam with just what you need would be a mistake as well. If you go into the exam with a really comprehensive knowledge of all things cervical spine, then it's going to be in your interests. Because then when you're asked the questions, they're going to be examining you at a sort of a lesser level than your actual knowledge is. And everybody who's passed the exam will tell you that the peak of their knowledge for their entire career was walking into the final segment. As soon as you walk out of the final segment, it's gone. but you'll never have as much breadth and depth of knowledge as you have when you walk into that exam.
Good point.
And you might only get examined on 10% of it, but you don't know which 10% it's going to be. So the better prepared you are, the better breadth and depth you've got, the better you're going to be.
One of the other things similarly in preparation is some consultants would say, the exam answer is this. Or a lot of bone schools, people will often ask, but what is the exam answer for this condition or this situation? What is the exam answer, Ric?
So what drives that comment? What drives that exam answer? Is it the consultants at bone school saying this is the exam answer, or the candidate asking what's the exam answer?
I think
so. As an examiner, I'd tell you there is no exam answer. That the answer that you want to give is the answer to the question you've been asked. And what you're doing by saying the exam answer is saying that every question that you're going to be asked is generic. You know, what is the exam answer to a valgus knee? Well, which valgus knee? The valgus knee that's got bone loss, the valgus knee that's been like that all their life, the valgus knee from trauma. You know, you have to look at the specifics of the question and talk to the higher decision making of that case. So I would say quite categorically, there is no exam answer.
And that feeds into what you were saying before. It's not like an OSCE where you have to say these things to get these points.
Okay.
It's you're saying what your synthesis is and what your opinions are based on what you've learned and the facts and your experience, and then they'll make an impression of you. There's no single specific thing a lot of the times that will get you over the line versus won't.
Correct.
Is that a fair assumption?
Yeah, and again, we talked about some of the subjective assessment in the Vivas. That it's how you present that synthesis. How does your brain work your way through the problem? That's what we're assessing, you know.
Yeah.
Not can you remember the 15 causes of you know, hypercalcemia? And I don't know that there are 15 causes of hypercalcemia.
16.
So.
Another thing I was told is that if you say enough things, you'll get there eventually. So the sort of scattergun approach, especially for eyesores or even for clinicals, just keep saying things and eventually you'll get them. Is that something that works? Is that something that you'd be reflected on poorly for? Or
you might need to wake the examiners up at the end of the segment if you do that. No, again, the examiners are very experienced in knowing the people who are just throwing out, you know, a list of differentials from a textbook, because that's okay to start, and then they're going to hone in on specifics. So scattergun approaches don't work, and certainly in things like the exam, in the writtens and the essays, and certainly in the eyesores, a scattergun is really a negative thing.
So what if you say I want 3 differentials and I can think of 6? How's that interpreted? Do I get bonus points if 4 and 5 are right and 2 and 3 are wrong?
You've been asked for 3 differentials.
Yeah.
And what if your last 3 are absolutely completely off the wall crazy? And you've just failed that question.
So answer the question. That's the bottom line.
Answer the question.
For the whole exam.
For the whole exam.
Easy as that.
Yep. That's right.
And Rick, to conclude the interviews, any parting words for people that might be coming up to the exams for advice?
Parting words, I say to everybody, don't be a victim. If you prepare and you are, you've done the training, you know, the Australian Orthopaedic Association training is second to none in the world. You know, it's overseen by a group of dedicated people. The clinicians that you meet in the hospital system across the country are first rate, and they're there to train the next generation. And so if you've done your training, if you've taken it all in, you've asked all your questions, you've done all your preparation, you are prepared to pass this exam. We don't want a logjam of people who can't pass the exam. It's meant to be an exit, and it's meant to be an exit that tells the community that you've met a standard, and we've maintained that standard, and we've protected the community. But it's also meant to be a process that tells the candidate that they're ready. It gives self-confidence. I have passed the exam, I have passed my training, and it is amongst the highest standard training in the world. And so have confidence in that. If you are there at that situation and you're ready to sit the exam, you wouldn't want to be anywhere else. You're terribly nervous on the day, you're sweating, you just think, oh my God, I'd rather be anywhere else but here. Stop and think. If you're not in that exam, then you're not going to pass it. The only place you want to be on that day is in that exam. And you've been through that with all the stuff that happened with COVID. And the stress that put on people who thought that they might not get their exam really highlighted to me how positive it is to actually be there in the room at the time.
Mm.
Because once you're through, and there are going to be some people who don't get the result that they want, but if they're prepared, if it's just been one of those things, then I can look them in the eye and say, you'll get it next time. And you know, we all know that's a dreadful thing to happen to somebody. It's devastating, but it's not because they didn't prepare properly. You just want to keep in mind that you're there for the right reasons. It's your exam. Enjoy it. It's a life event, you know, and it is a something that all in Australia, all surgeons, but certainly all orthopaedic surgeons have in common. So I think that would be my best advice is try and relax, enjoy the process, enjoy the fruits of your labour, and work hard to achieve it.
Thank you very much for joining us, Ric.
Thank you.